Here we will be discussing symptoms of autism. Obviously, there are going to be multiple symptoms for different types of autism, but some of them are going to be unique that are common to most of the types of autism. So, it is a disability that is a development disability, nothing physical or a disease. So, what happens is it is associated with some sort of disease in the common world, but actually it is just a disability or disorder that is happening because of some differentiated growth of brain parts. There is usually no cause or treatment affected for it. So what happens, we just have to understand the basic conditions that are being seen. Means we have to see the causes. Most of the people affected by autism, they will be moving differently, learning differently, interacting differently even. So along with the repetitive behaviors, for example, they will be doing these 4 or 5 conditions: moving differently, learning differently, interacting differently, and some repetitive behaviors, means repetitive movements of their body parts, you will be seeing among those people. There are a lot of more different symptoms that you can see, and we will discuss further onwards. Other multiple symptoms that are very common in these type of people are who are having autism. One of them is they will not be able to do a eye contact with you properly, never a stable eye contact. Then the other one is they will not be responding to their names, especially those kids who are under 1 year. They will not be starting to respond to their name when you're calling with their name. Usually kids will start to respond by that time if they're under 1 year. Near the end of 1 year, or by 9 8 9 months, they will start doing that. Then the other thing, they will not be interacting inside the game that is relative to other people. Mean they will want to play alone with their own toys or everything. They will not be interacting in games with other people. Then another important thing is you will see that they will not be able to express the anger or happiness in a normal way. Even if they do that, that will be very extreme or some other way that is out of the blue that you will not be understanding as a normal person. Then other point is they will not be able to use their hand gestures. They will not be able to use the gestures to explain their feelings. They will not be able to use their facial gestures to express themselves. These are the major symptoms you will see. The other symptoms you will see that they will not be showing any interest in pointing out things, that what they like, what they don't like. And opposing to that, contrary to that, to the other extreme, they will not be able to judge that if someone is liking their behavior or not. They will not be able to understand your side of emotion as well. Then they will not be able to playing in groups, as I explained earlier. Then most important is they will not be able to play in a role play, just like kids used to like, that they want to become a teacher, behave like a teacher, behave like a student. They will not be able to play those games. Then in the last part, what is, they're not able to sing, dance, or express themselves in different types of activities that usually children love when they're growing up within 1 or 2 years of age, or 3 years of age. They will not be able to understand and express those things. These are the major symptoms you will be seeing in people having autism, or these are the symptoms you should see when some of the anyone or some of the children are having these symptoms. You should be considering them for consultation. Few other characteristics you will see in them is that, for example, if a child is playing with a toy, they will be consistently wanting to play with the same toy. They will never want to change that, even if you want to, even if you push them to. Secondly, they will be having a repetitive behavior. They will start repeating the same words. They will start moving the same way again and again, having flapping movements or other hand gestures continuous, that will be repetitive. Then they will be having some language delay skills. Mean they will not be able to speak like a regular child who is developing. With regards to their age, they will have a gap of learning. Then there will be rapid movements in their hands, legs, or even neck. Then there will be delays in learning in the cognitive development. Means their intelligence, or what we call in common language intelligence level, is not going to be perceived as a normal person. Then they will be starting having digestive problem as well. Now, this can be a bit tricky part. Some parents will see that, okay, this is a digestive problem that has nothing to do with the autism, but these are associated symptoms with that. So another thing is they might have some epilepsy related disorders, alertness, hyperactive, or extra laziness, or extra attentive. But they will be to the extreme extent. Whatever they will be doing, they will be doing to the extent, extreme extent. Unusual mood swings will be there. So you will not be able to judge their behavior. All these symptoms you have to take into account. There will be unusual times of sleeping, eating behaviors are going to be unusual. You have to take these small things. Don't ignore them. These are all symptoms of autism, but they might not be the related part of autism in your child or in someone's child. But you have to keep an eye on these points. These are the symptoms that can lead to that, and in time diagnosis is much better point, so you can improve the life of a child. Thank you very much.